talk to you today about mechanical ventilation and understanding the different types of pressure alarms. So you understand the difference between high pressure and low pressure. Now, when you think of these mechanical ventilation, pretty much what's happening is that the patient is unconscious, or they're actually, let me take that back. They may be conscious, but they're not able to breathe on their own. So they have an endotracheal tube, right, that's down their throat, which is connected to the ventilator system, which helps them to breathe, right? So what's happening here is that you have to think about why is the pressure higher, that's causing the high pressure alarm. Like, what is contributing to the pressure being increased? One of the reasons why this may be is that they are biting on the tubing, so because they're biting that tubing, it's building up the pressure in the system, which is what's going to trigger a high pressure alarm. Another reason why it may be is because there's a buildup of condensation inside of the tubing. So this is kind of showing you, this is similar as far as the type of tubing that is used, but inside, literally, you would see a buildup of like water and all this condensation inside this tubing, and that is causing the pressure to be higher, and that's triggering the alarm. So a lot of times, so some of things that we may do when this happens is, for one, we need to remove we may need to take this apart and get rid of the condensation. So get rid of the excess fluid. The patient may need like a bite block to stop them from biting on the alarm, but it's usually because of like a kink, right? Like a kink. They're biting on it. There's condensation inside the tubing. Low pressure alarm is different, right? So with low pressure alarm, there is a leak, right? So there's a leak. So because there's a leak, right, there's a leak in the system. So that's decreasing the pressure in the system. So that's the reason why they have a low pressure alarm. So imagine literally that this thing is hooked up. It's longer, of course, but it's disconnected from. Let me put this right here. All right, it's disconnected at some point in the system. So of course, it's a low pressure alarm. So when you think of low pressure, think of like a leak. All right, so pretty much you want to identify with a low pressure alarm the source of the leak. And then if you have problems still, then you need to tell the respiratory therapist. All right, so go to our website, choosenursing.net, and you can learn more about our 3-day replay. In there, I actually go over not just only the high pressure alarm versus the low pressure alarm, but I also go over what are the different types of ventilation. You have pressure support ventilation, you have synchronized ventilation, you have different forms of ventilation. So I go over ventilation and also a lot of other categories: reduction risk potential, basic care and comfort, disease processes, medication administration, restraints, fluid electrolyte, hypertension, cardiac disorders, thyroid disorders. You get a lot of information. And on top of that, you will also receive our Video Vault library, which includes more trainings. As literally, you're looking at about over 90 videos plus practice questions, and then also quizzes inside of the 3-day class as well. So you get quizzes that will test your knowledge on what you're learning from the content review. So it's also for RN and LPN test takers. So visit our website, choosenursing.net, under the Shop Now product section, and sign up today. All right, have a wonderful day. Bye-bye.